A year ago, we contacted Dr. Judy Griffin. I did. I saw a write-up in one of the Fort Worth newspapers, and I said, I need this in my own personal life. Let me give her a call. So I did, and had a consult with her and found that I was benefiting personally from the essences that she was providing for me. And we talked about how has she been using this in other parts of the world, in her private practice, and how can we begin to start using it perhaps at Baylor.
They invited me to come and do an aromatherapy study with them, and the aromatherapy would include the flower essences as well as essential oils that I would make.
Our patients that are going through chemotherapy have to take a lot of high-dose drugs. So if we don't have to introduce into their body any other drug or chemical, that's positive and that's helpful for their recovery. We're finding that the essence helps them to reduce their pain, their anxiety, and specifically on the pain scale, we're seeing it through numbers, and we're able to document that. We did have a patient about, probably about 8 months ago. She did not like to lose control. And anytime that she used pain medication, she was finding that she could not speak clearly. She was hallucinating. And because the pain was taking up so much of her emotional energy, it was keeping her from being able to heal physically. She was kneeling in the middle of her bed, rocking back and forth, and wanting anything to get rid of the pain except the pain medication. So the doctors asked us to come in and see whether or not there was something that we could help her to gain some control. And we used the flower essence, the bouquet of harmony. We used breathing techniques, visualization and refocusing. And a combination of these, we were able to bring her down from 9 on the pain scale, 10-point pain scale, to 3. She thought it was wonderful. The team thought it was wonderful. The doctors thought it was wonderful because she was able to then use her physical energy to help heal the body rather than being overwhelmed with the emotional energy it was taking to overcome the pain.
And I was to the point where I was thinking that it didn't matter if I lived or I died. You just on some level start giving up, and your body starts giving up.
Flower essences heal, in my opinion, in my experience, by releasing suppressed energy. So all the hurts and all the fears, all the things that are holding you back are just released like a ribbon untied.
The scent of any flower, herb, or essence goes directly to the brain, and your brain is a hologram. Everything that's happening in your brain happens immediately in your body. So when you smell lavender or use a lavender essence on the body, it's going to immediately make a difference everywhere in your body. Your body will get the whole message to heal, which is what we look for in a holistic approach of healing the person as well as the body.
The products and the flower essences I make in Texas are really effective because these plants bloom under such high stress.
I received guidance from the flower as to what it could help us with, and from what they explained to me, they bloom under stress, and we can do the same thing.
Nate Marston was diagnosed with multiple myeloma, a deadly immune-suppressing cancer. The recommended treatment is a painful bone marrow transplant. However, since few people actually survive this form of cancer, Nate looked for an alternative. After consulting with Dr. Griffin and oncologists from several hospitals, he realized he had nothing to lose by trying something as unconventional as flower essence therapy.
We kept working with essences, and I did use some nutrition and herbs with them as was appropriate. And within 2.5 years, instead of really not even being alive, this person was still here. He was in good health. He had not lost weight or gained an unusual amount of weight. He looked just almost exactly as good as when he walked in the door originally.
By observing the effects of various flower essences on her clients, Dr. Griffin has compiled an impressive list of dramatic healings. from overcoming poor concentration to managing the pain of chemotherapy.
Children are especially prone to experiencing flower essences in a positive way. They don't have a lot of baggage, let's call it emotional baggage, so they respond very quickly. We have children with colic who calm down when they use an essence like dill or chamomile, and you can use it right on their tummy. You have children who are angry. I had one family that came, and the mother was very busy and preoccupied, and one of the children responded to this by screaming all the time. He'd just yell at the top of his voice, and there were other children in the family, and everybody just sat around. Everything revolved around this child, and I used a combination that I now call abate anger, and the child calmed down within 5 seconds and never screamed again after we put that essence on him in our consultation, and of course they took some home with them.
Texas school teacher Lisa Wilson put flower essence therapy to the test when she requested Dr. Griffin's assistance in a simple experiment. Her 6th grade class of attention deficit children needed special help for a very important standardized test. Together, they came up with a new blend which produced some surprising results.
When they started smelling the essences on my arm, you would watch them anywhere from 20, 30 seconds to a minute calm down and begin to read again, begin to do a math problem again, whatever they were working on. I noticed a remarkable difference. My 6th graders stayed on task longer than the 7th and 8th graders did in the same room.
As a massage therapist, Janet Taylor uses flower essences on her patients to help alleviate stress and release deep-seated emotions trapped in the muscles. While most of her clients are human beings, occasionally she is asked to make an unusual house call.
I was asked to treat a horse who had been a wonderful competitor in the ring, and then had an injury, and then was frightened of the ring and wouldn't go near it. And they had tried all kinds of training techniques, and they had tied the horse and punished the horse and rewarded the horse, and had no effect. And so I went out thinking, well, maybe we can try some of the bouquet of harmony and calm it down. Maybe it's just afraid. And within 5 minutes, it was looking out of my hand, and within, I think it was about 2 weeks, they had it back in the ring and showing and making big bugs.
Flower essences are a catalyst. I don't know that there are any cures. We are the cure, and flowers see us that way. They see us as already well. They hold the vision that we can get well on our own, and they work as a catalyst to promote that.
As we enter the 21st century, Western medicine is beginning to see the human body as whole rather than separate parts. And as a result, our concept of how to treat disease is changing. Doctors are finding that by bringing balance to our emotional states, our natural ability to heal is unblocked. The pioneering research of Dr. Griffin and others is showing that flowers are conscious beings and are here to help us gently reconnect with ourselves. Perhaps the future of medicine will be a blend of high-tech medical science and more natural methods of healing, such as the transformative power that exists in a simple flower.